GB News. Stephen Dixon and Ellie Costello clashed with Health Minister Karin Smyth MP over the additional £80 million GP funding. Tensions rose on GB News breakfast programme as presenters Stephen Dixon and Ellie Costello furiously clashed with Labour Health Minister Karin Smyth MP. The politician joined the hosts after the government recently announced an additional £80 million of funding for GPs to save time and stop masses of people having to head to hospital for unnecessary appointments. Speaking on the scheme, Ellie asked Smyth, "Family doctors get a £20 bonus if they keep patients off waiting lists. I mean, that's going to make people very nervous. They already find it very difficult to get a doctor's appointment, then they find it very difficult to be taken seriously and to get the referrals they need. Are you massaging the figures here to the detriment of patient care?" The health minister responded, "Our commitment to make sure that people are not waiting more than 18 weeks is absolutely our focus in the health service, getting those waiting lists down." However, as Stephen attempted to interject with a question, the politician refused to be interrupted and continued her point, which left the presenter furiously stammering. As Smyth explained the scheme, Stephen repeated, "Forgive me" 3 times in an attempt to ask another question. He continued with, "Forgive me, Minister," before abruptly exclaiming, "Minister." After finishing her point, the perplexed presenter stated, "Minister, please, before we run out of time. The problem with this is, if it's about treating patients on merit, if it's about providing the right treatment, why are you having to incentivize GPs up to a cost of £80 million? The politician answered, "We recognize that there is an extra administrative requirement placed on GPs and practices to make this work, and that's what the payment is for. To get patients better treatment, more efficient treatment, more effective treatment in the community close to homes, supporting general practices. We want to have more care taken out of hospitals and into the communities." The MP concluded, "That's what patients want, that's what we promised in our manifesto, and that's what we are determined to deliver." As part of the scheme, the government has pledged that by the end of this Parliament, 92% of NHS patients will be waiting less than 18 weeks for treatment after referral to a consultant. They say that between July and December 2024, the scheme called Advice and Guidance diverted 660,000 treatments from hospitals and into the community, linking GPs and hospital specialists before patients are referred onto waiting lists, so that tests and treatments can be offered in the most convenient place. GP practices can claim for each time they use the scheme to shift care from hospital to the community.